that more than a third of Vermonters are covered under that federal, health plans under that federal law. How do you deal with that? Won't you need some sort of congressional action? Won't there have to be, maybe bills passed here, but also bills passed in DC to make this happen?
Absolutely, and ideally, an ERISA waiver would be tremendously helpful to Vermont. Let's not forget that the people who are in ERISA plans are facing the same cost challenges that all the rest of us are facing. Vermont League of Cities and Towns, look at them. Every municipality in Vermont is now looking at, what is it, a 23% increase, 27% increase this year. I know that my own small business just got off the phone listening to my brother. They're having a meeting right now about shifting healthcare providers for the third time in 5 years because the one that they have just announced a 20-something% increase. The point is, what we have is not sustainable, and many of our ERISA providers are facing similar challenges. So I've talked to some of our bigger ERISA providers who say, hey, with or without a mandate, we'd like to know what you're doing. We'd like to know how we can be involved in helping design the system. And if you figure out a way to contain costs, which we must, we might want to join you. So let's not suggest that anyone is our enemy in this discussion. Everybody's our friend.
But to cover that 1/3 or more, you do need some federal action.
We do.
A lot of Vermonters work for national and international companies. UPS drivers, for instance, their healthcare plan is crafted at UPS corporate headquarters in Connecticut, I think it is.
Sure.
How do you roll them into a Vermont-based single payer plan?
Well, let's see what Dr. Shaw brings back to us in terms of recommendations. But let's not forget that UPS has the same challenge that we have in Vermont, rising healthcare costs that are not sustainable. And let's talk about what we're talking about here that we plan to do differently than the other states. The goal is to have a healthcare system where health insurance follows the individual is not an obligation of the employer. That would be really attractive to UPS and all the other ERISA providers. Second, that uses technology so that you have your records on a card and use that card to contain costs, both duplication of services and delivery of services to keep Vermonters healthy. Third, a system where you adjudicate the bill when you come out of the provider's office so that we stop wasting the 10 to 12 cents on the dollar chasing money around. Huge savings to all Vermonters if we can do that. If you're in an ERISA plan and you say, hey, we've got a system up there in Vermont that actually contains cost, they're probably going to want to fight hard with Congress with us to buy in. And finally, a system that reimburses providers based on healthy outcomes. That's where medicine has to go. If Vermont can help lead, we'll create jobs, businesses will move here, we'll have a bright economic future.
What if Dr. Shaw doesn't present you with a single payer plan? What if he presents you with public option or a third way, which he's hinted at in speeches around the state?
Well, he's coming back with 3 options, don't forget.
Right.
One is a single payer, because it's outlined in the bill that it has to be. The other one is a multi-payer, and the other one is up to him. So we'll eagerly await that report. But fighting over the providers in Vermont, the payers, is the easy part. Let's not forget we only have 3. And I explained that to Governor-elect Rick Scott down in Florida the other day, who's a very different perspective on waivers from Washington on healthcare than we do. He said, you only have 3 payers? And I said, yeah. I said, we cover people with 300% poverty. We're bankrupting the state of Vermont. It's not sustainable. I can't write a budget under the current plan. We provide health insurance to most Vermonters, and we have no cost containment system to go with it. So not only are we bankrupting our small businesses and the middle class, we're bankrupting the state of Vermont.
What do we do about all the Vermonters who get their health care across the river at Dartmouth, Hitchcock, or elsewhere in New Hampshire?
Well, let's not forget that we have a couple of single-payer healthcare plans in Vermont right now. We have Dr. Dinosaur. Right. Both Hanover and Albany are involved in that delivery system. We have Catamount. Both Hanover and Albany are involved in that delivery system. So if the 2 systems that we have right now include them, why would we possibly think it's an obstacle to include them in the future?
You mentioned earlier that it's not a promise to pass single payer, it's a plan and a promise to work hard. and you said it'll take maybe 1 or 2 years. If you're not able to pass a single-payer healthcare system or do massive reforms in your first 2 years as governor, will you deem that first 2 years as a failure?
No, I wouldn't deem it as a failure. I understand how ambitious this is, but here's the failure. We act as if we have an option. One is to stick with the current system and everything will be beautiful, and the other is to explore other alternatives. And you know, we have some real challenges as a state that we might as well start talking about. We are losing our rural health care providers because the reimbursement system does not pay them enough to stay in business. Vermont without rural health care providers is not a Vermont that we want to live in. Our hospitals are under tremendous economic stress because the reimbursement system, one could not design from scratch, present to a group of reasonable people, and have them say, this reimbursement system makes sense. So they're facing real challenges staying in business. We will crumble of our own weight if we don't act. So the question is, will it be a failure if we don't act in 2 years with a thoughtful bill that helps to reinvent the system? Of course it'll be a failure. We have an obligation to try to get this right, but let's not underestimate the enormity of the challenge, where the minefields are. There are every corner, they're going to be at every step. That's why we put this dream team together to help us wade through it.
Question for Steve. Do you have to set up some sort of Chinese wall here to, so you don't work on issues that your former clients had pending before Fishco over the state?
Yes.
And have you done that, and do you know how extensive that's going to be?
We've done it. It's not, doesn't have to be very extensive because the nature of my business was to work on discrete issues in legislative sessions. I wasn't practicing law before Fishco, so there won't be very many issues, but I'll keep an eye on it, and we'll have to do that. Fishco's got enough infrastructure so that if I have to step out of a matter, there'll be somebody there to handle it.
Is there a reporting infrastructure on that, or I mean, how would anybody sort of check up on you in that regard?
Well, I'll be as transparent as I can be. Call me. I'm in the book in Tunbridge between now and when I start work.
And you're the reporting field.
In healthcare, I've heard it said that it's not really a matter of who pays, whether it's a single payer or we currently, I guess, have a triple payer. It's really a matter of the underlying cost, and you know,
Right.
And you have huge markups on an awful lot of what you see in healthcare, particularly in the pharmaceutical field, but medical equipment and so on. And you know, we've been talking about single payer for 20 years. The question of who pays isn't the real issue, the real minefield, the underlying costs, and how and when are we going to get at that?
You know, I think, you know, we could all be a little bit cynical about politicians who talk about healthcare reform, for good reason. Most of them, Democrats and Republicans, have taken so much money from the special interests that not much change seems to happen. The second ingredient is, as you look at it historically, let's put it this way, I think we have a better opportunity to do healthcare reform because of technology than we've ever had before. If I stood before you just a short time ago and said, I think we can move to a system where you can have a card in your wallet that has your medical records, that allows providers to track what people have done for you before the next provider gives you service. You can use that same card to be able to transmit a quick answer from your payer so that most bills can be adjudicated at the counter when you come out. You would have said, how can you do that? Most of the providers in Vermont aren't even linked to a network. Well, one thing that we've done over the last few years is pushed very hard to hook all of our providers to technology. We also have programs being developed by IBM and other companies. They're going to help us adjudicate bills. We're in discussions with those companies and have been for a few months now. So we have, I think, a potential to contain costs with technology, with developments, you know, in terms of providing healthy outcomes, and the work that's been done there that just weren't there just a few years ago.
You're going to have to spend money in the short term or save money in the long term? If so, where does that revenue come from?
Well, you are gonna have to, but the answer is that the good news about the federal bill is that Washington is gonna work with us to give us some of that startup capital to get the job done. And one of the things that is really good about the federal health care bill is that President Obama is committed to helping states like us, those that wanna really change the system, contain costs, provide universal access. They're committed to helping us financially, and that some of that financial help's gonna come this winter.
In terms of controlling costs, isn't it really a matter of making sure that end-of-life decisions and other decisions that individuals make along the way are done so in a way that is fruitful for them personally, but also that isn't as costly for the whole system as it might be? And so how would you really deal with the meat of the issue, which in my view is that, how do you get people to really change the way they think about healthcare and the way they think about prevention and all of that?
Well, there are a lot of components involved in cost containment, and I'm looking forward to Dr. Shaw's work to make some really firm recommendations there. But there's no question that end of life tends to be the area where we spend the lion's share of healthcare dollars, and I think Vermont's ready for a conversation about that too. Obviously, we do a lot of planning as a state, as a society, for how we come into life. We're much more reticent to talk about end of life. So we'll put that on the agenda front and center.
So what are you suggesting when you say that? What do you mean?
Well, I've already said that I think we need to have a much more open conversation about how we spend our healthcare dollars and how we ensure that any Vermonter that lives here not only has an extraordinary start in life, but also ensures that they have some input into the end of their life and how we end our lives in this state. All I'm saying is, when I talk to Vermonters about this state, they want it to be the best place to live throughout one's life, including as we grow older. And it should be the best state to age in. Great healthcare system that acknowledges that we need to plan for end of life as well.
So are you talking about what some people call death with dignity or physician-assisted suicide? There's a movement in the legislature to pass that, didn't go anywhere. Would you support that this coming session?
I've said before, and I'll say again, I do support end-of-life choices. I think that individuals with their physicians should, when they're terminally ill, be able to make choices about how they spend the last 2 or 3 weeks of life. But I don't think that that's related to healthcare reform.
Do you think that there ought to be limits on access to certain procedures and access to emergency rooms and that sort of thing? Like, there was a Tiger Team report that came out last year, and we've actually adopted, I believe, some of those changes. And do you support more of that kind of thing across the board outside of Medicaid for Catamount and other programs? Or?
I think one of the big mistakes we make when we talk about reforming healthcare is that we're somehow talking about rationing healthcare. We want every Vermonter to have access to quality healthcare to keep them healthy and allow them to lead productive lives. It's more about the choices that we make during our lives that cost us money than it is about access to care. It's how we eat, what we eat, how we exercise, how we lead our lives, the choices we make about alcohol and tobacco and other substances. We have a lot of work to do, but it's got to be a holistic approach to keeping Vermonters healthy. And I think if we get into the discussion of too much care, that's a mistake. We're really talking about changing the attitudes about how we give the care.
Do you want to continue then with the blueprint?
Yes, I think the blueprint has really been very helpful to us. I think as Susan just said, we wouldn't be having a discussion now about the reforms we're talking about had it not been for much of the work of the blueprint that's put us in the position that we're in right now.
If I could go off topic for a second.
My dream team might leave.
Putney's a long way from Montpelier. I've heard you're buying a house. Are you going to be the first governor in a long time to actually live in Montpelier?
Well, Putney's my home, and I'm not leaving my home. But we are going to put a double wide on the State House lawn, so I can stay here for a week.
Have you made an offer on a house?
No. If there's rumors that I'm buying a house, they're just that rumors. I have no intention to buy a house.
So are you gonna commute then?
No, you know, I have always rented during the legislative session because one can't move back and forth every day. So I'm gonna rent a house that's owned by somebody else and furnished by somebody else, as I have every year of my legislative life here. So there's no big change.
But are you
You
gonna
might
live,
see me in a grocery store more often than you used to because it's not just 16 weeks.
so you're gonna stay in Montpelier and rent this house year round then?
Yes. I'm gonna use it during the week, year round, and go home on weekends.
There's a hearing over today in the State House about issues with the modernization effort over at DCF. Can you talk about the 20 positions that you've authorized for fiscal year 2010 to help resolve some of those?
Sure, I mean, really, I should turn it over to the secretary designee who's on top of this, but bottom line is, as you know, delivery of service has been a huge challenge. We have not been serving Vermonters the way state government should be. The Douglas administration and we have agreed that we need to hire positions to make sure that we don't have people standing in line and losing their benefits when they need them most. So I'm really grateful to the governor and to the administration for working together with us to solve the problem.
Can you talk about, I mean, it's not cheap, 20 people, 70,000 a pop. What does that do to the FY12 situation?
Well, it doesn't help us, but at the same time, we have an obligation when Vermonters are feeling a lot of economic pain to be sure that they get the services that they need when they need them. And finding that balance has been the tough part. But as I say, I'm grateful to Governor Douglas and his team in solving the problem. And we understand we have a budget challenge, but we've got to do right for Vermonters.
Have you heard from Peter Shumlin, the Vermont Yankee? You wrote a
Yes.
letter, right?
Yeah, we've been having
Did you get a response?
We've been having ongoing discussions with them down there, and it was the Peter part that threw me.
Oh, sorry.
But
Did I
that's
get
okay,
wrong?
close enough.
Sorry.
We'll be going down to Vermont Yankee on Friday and having ongoing discussions with them during the plan.
What do you hope to learn at that? I mean, you know a lot about the
Well, as you know, I
plan.
feel very strongly that it's penny wise and pound foolish to shut the pumps off at a time when it seems increasingly clear that the tritium and other nuclear substances are heading towards the bedrock and the groundwater. You know, if those isotopes get into the aquifer and into the groundwater and burn it, we have a real challenge that we're all going to wish we didn't have. I've said many times, even though some said it was hyperbole, that I think this will be the biggest man-made environmental disaster in Vermont's history. We can mitigate some of that potential by continuing to pump the water, contaminated water, into tankers and hauling it out of Vermont. So it just seems to me imprudent to shut the pumps off. I would like to add 4 additional pumps and keep pumping.
What's
And do you
holding
have
them
any
back?
hope that Yankee's gonna listen to you?
Well, you know, all we can do is hope. I assume they want to have a good relationship with us. We want to have a good relationship with them. It's been a tough relationship. One way to improve that relationship would be to turn the pumps back on. Thank you.